the title of the next speech, which is going to be delivered by lecturer Bahar İnkaya from Yildirim Beyazit University. Bahar Hanım, are you there? Hello, good morning. I would like to first of all thank you and those who have organized this symposium. I'm going to talk to you about the nursing care plan for a prospective Hajj with diabetes during Hajj. Let me start my presentation. As you all know, every Muslim has to perform Hajj at least once in their lifetime, and every year from different corners of the world, many prospective Hajj pilgrims come to Saudi Arabia. The average age of those pilgrims is Hajj, and most of the time they have chronic diseases. This is why we see common problems among them during Hajj. Of course, being an elderly is part of the development stages of human life, and most of the time, prospective Hajjis would like to come to Hajj when they are old. That's why the Turkish population is also getting older and older, by the way. So that's why we are seeing chronic diseases more commonly, which include diabetes. 1/3 of the global population over 65 years of age have diabetes, and the remaining may have diabetes. What is diabetes? Diabetes is caused by the absolute lacking of insulin hormone, which is increased by the beta cells of the pancreas, and that's why the people who cannot use the insulin, and it brings along many metabolic problems. In this regard, it is also very common among the elderly people. That's why during the Hajj, in order to prevent the elderly people from facing problems, we need to provide the elderly people with training, coping techniques, problem-solving skills, and they should be trained on these topics. And this is actually self-management of the diabetes. So when you go to Hajj, and if you have diabetes, if you are able to manage your own disease, if you know when to measure your blood glucose, or how to store the insulin pens, or when you have hypoglycemia, if you know what to do in such a case. So these are all related topics to self-management, and if you are knowledgeable about these issues, you will have a more comfortable time during Hajj. So in this regard, exercise, physical activity, compliance with the diet, medical treatment with medication, avoiding risky behaviors, and self-monitoring are among the self-management issues. But if you are not able to achieve self-management, of course you will be definitely facing some problems during Hajj. What are the most common problems of pilgrims with diabetes? Hypoglycemia, sore on your feet. So we have actually such studies covering such topics in the literature. Hypoglycemia means that your blood glucose level is below 70 milligrams per deciliter. So that's why you may be suffering from confusion or shock or at the advanced level. So if you are a diabetes patient using insulin pens, 90% of them are suffering from hypoglycemia. According to the global research, type 2 diabetes patients at 60 years of age on average, who have this disease for more than 10 years, 41.9% of them suffer from hypoglycemia. In the old prospective pilgrims, when they face hypoglycemia, they may fall and they may need to be hospitalized. So what are the factors leading to hypoglycemia? Excessive use of insulin, or hot shower or hot bath after insulin, skipping the intermediary meals, and going from a hot climate to a cold cold place all of a sudden. So these are the common reasons. And when you are during the Hajj, you walk a lot, and if you actually use the insulin pen on your leg, then hypoglycemia is a possible circumstance that you may face. That's why the nurses should warn the pilgrims against this. If hypoglycemia is not treated, then it may be life-threatening. And in this regard, so what should we do as a nurse? If we are a nurse accompanying the elderly people going to pilgrims, if they do their job properly, many problems can be avoided. If the elderly person actually person's blood glucose level stays within limit, then they can complete their Hajj without any problem. And we have to monitor the pilgrims before Hajj, during Hajj, and after Hajj as nurses. In this respect, I would like to share with you a table. If there is a complicated situation of a prospective Hajj, in this respect, we see the blood glucose level of the last three levels. The hunger glucose level should be between 100 and 180 milligrams, and the blood pressure should be less than 140/90 milligrams. In this respect, of course, during the Hajj, the climatic conditions may change, or sometimes you may skip some meals, or you may be faced with some changes. Of course, keeping your blood glucose and blood pressure within the limits may be challenging. During the Hajj, you walk a lot, there is excessive physical activity, you may skip some meals, and you may continue to provide your insulin pens at the all doses in this respect, and you are providing the pen to your leg. That's why you should get in touch with your nurse, and you should understand what to do. That's why you should change the dose of the insulin pen that you are introducing to your body. And of course, as you are in the sacred land, you would like to perform namaz all the time. The temperature is quite high, and you may suffer from excessive fatigue. That's why you may face hypoglycemia more often than normal. Of course, food care is very important, and you may see some wounds in your on your feet, and if you are already suffering from hypoglycemia, this situation may get worse. Skin complications, infection, ulceration, or gangrene may cause some wounds on the foot. According to a study, we see that acute foot wounds are among the most common problems of the pilgrims, which are followed by hypoglycemia and hyperglycemia. Redness on the foot, or there are some bruises because of excessive walking. Only 37 out of 281 pilgrims with diabetes use medical shoes. Medical shoes are very important. Shoes which actually grip the feet to the full extent possible. That this is very important to choose such kinds of shoes. So of course, the shoe selection is very important. You may be suffering from bunions or some hammer fingers on your feet. That's why you may need a different sole on your shoes. And of course, you should select your shoes properly. I don't want to go into the details of the nail clipping. Every day, the pilgrims should clean their feet, the space between their fingers, and they should check the sole of their feet. They should check if there is any swelling, if there is any pain there. And in addition, they should also apply some moisturizer to their ankles in this regard as well. And how to store the insulin during the Hajj. This is also very important. Saudi Arabia is a country with very hot climate conditions. That's why insulin hormone is also sensitive to the temperature. And as the pilgrims are staying outdoors for a long time, the storage conditions must be proper, and according to the literature, there is a study concerning this topic. Most of the time, the pilgrims don't bring enough a bag where they can properly store their insulin, and most of the time they don't see a doctor, and because of sweating, because of mobility all the time, they suffer from upper respiratory diseases very commonly. And when we should store the insulin pens in a proper bag under proper storage conditions. We should inject it when it is at the room temperature, and the spare insulin pens should be kept in the fridge until the expiry date of them is over. And if the pilgrim has brought a proper bag to store insulin pens, it is the best case scenario. The pens, the flacons, or the cartridges, when they are opened, they should be either kept in a fridge or in under 28 degrees Celsius. There are some factors which have an impact on the absorption of insulin. Of course, the type of insulin, the injection dose, the body temperature, the ambient temperature, and exercise, physical exercise, as the pilgrims walk all the time, the depth and the location of the infection. We should avoid injecting the pen to the same part of our body all the time, and sometimes the insulin doses are not mixed sufficiently. So if the prospective pilgrim with diabetes have enough knowledge about insulin treatment, they can continue their insulin treatment during Hajj as well. What is important is all as follows. Before you go to Hajj, you should see a doctor. You should have enough number of blood glucose measurement level tool and proper bag to store insulin, or fruit juice, or sugar for hypoglycemia, and you should have an ID card which says that you have diabetes disease in case you faint. According to the studies conducted, diabetes is a cause which increases mortality rate and hospitalization rate as well. And according to a study in 2004, among 140 pilgrims, 25.7% had diabetes, 7.1% had diabetes ketoacidosis, 1.4% had hypoglycemia. So most of the time, the pilgrims with diabetes are hospitalized. The hospitalization rate among them is also very high. So what should the nurses pay attention to when they join the pilgrims to Hajj? They should identify the number of pilgrims with diabetes. They should identify if they have different chronic diseases as well. If they are using pens, the nurse should make sure that those pens are stored under proper conditions. Maybe on the first day, the nurse should brief the prospective pilgrims, talk about the storage conditions and insulin application. In this regard, maybe these trainings can be held later on at appropriate times. If possible, the blood glucose levels should be registered to the electronic database, and mini mental tests can be conducted to assess the cognitive situation. I would like to talk to you about the situation before Hajj. Of course, the prospective pilgrims should get in touch with the diabetes nurse or a physician. The necessary tests must be conducted. They should be learning about the indications of hypoglycemia. They should be provided with a bag to store the insulin in pens under proper conditions, and they should get medical shoes. And during the Hajj, they should measure their blood glucose level at irregular intervals. They should check their feet, and they should wear medical shoes. So I would like to talk to you about COVID-19 and diabetes. there is a study which was conducted on COVID-19 diseases. Patients with diabetes are compared with those without diabetes. It was found out that they need more intensive care, they need more mechanic ventilation, and their hospitalization period is longer. And the mortality rate is also higher among them, among the COVID-19 patients with diabetes. So in summary, in Turkey we don't have enough number of studies about Hajj and pilgrims with diabetes. That's why before Hajj, if you have diabetes, you should make sure that you see a physician to check your blood level, blood glucose level, and that nurses should follow up your situation. That's how we can ensure the protection of the health of the elderly people and increase their life quality. And they can. I would like to thank you very much for your attention. Thank you very much, Bahar Hanım. Thank you for abiding by the time as well.